Good afternoon. Thank you for joining us. My name is Megan Pearson. I'm the Chief Communications Officer, and today we are very honored to have the United States Surgeon General, Dr. Jerome Adams, with us today. We have a couple of other folks who are also joining us that will be available for comment. Pardon me while I unmute. There we go. Apologies. So we have a couple of other folks with us today as well. We have 2nd District Supervisor Zach Scrivner. We have 3rd District Supervisor Mike Maggard, Kern Medical CEO Russell Judd, and President of Grimway Farms Jeff Huckabee, who will all be available to share what they saw today. And then we'll take questions. We are going to go through this very quickly. We are pressed for time, so we appreciate your cooperation in keeping your questions succinct. And again, we'll get to that after all the presenters are done. So first I'd like to present U.S. Surgeon General Dr. Jerome Adams.
Thank you. Well, good afternoon, everyone. I am going to take off my mask because I am 6 feet away from all of you, but I want to make sure people understand the importance of wearing a face covering whenever you're out in public. Had a great day today. We went by the fairgrounds and saw how testing is being done in the community, particularly with the farming community. We also saw an alternate care site where people who have been diagnosed with COVID but that aren't able to return back home for an array of reasons. They may be homeless, they may not have an environment where they can isolate appropriately, are being supported by the county in mobile units. We did a tour of Kern Medical Center and got a chance to talk to many of the people working there about the challenges that they face, but also the great things they're doing to promote COVID testing there and to take care of people within the community. And then we just had a great roundtable with business leaders, with folks from the education community and beyond about how they're overcoming the pandemic right here. We talked about the fact that we really need to get away from this idea of health versus the economy. Several business owners brought up their concerns about the need to get businesses open, and I shared those concerns with them. And I said the quickest way to get businesses open is to drive down community transmission rates. Because at the end of the day, even if we tell places to open, if consumers don't have the confidence to go back out, then you're still not going to get back to where you need to be. The same thing goes for schools. The number one predictor of whether or not you're going to be successful in reopening schools is your background community transmission rate. So if you want your kids back in school, then we need to pay attention to those measures that will drive down our positivity and case transmission rates so that, again, we can protect the teachers, the cafeteria workers, the bus drivers who also need to be there to support those students. We talked about the mental health aspects of this pandemic, and I'm incredibly worried about the isolation, the loneliness, the increase in suicide, the self-medication that occurs when people aren't connected to other human beings. But again, I want you to know that the quickest way to alleviate those concerns is by everyone taking the basic public health measures, what I call the 3 W's, that will help us reopen our economy and reopen our communities. And the 3 W's are: number 1, wash your hands; number 2, wear a mask; and number 3, watch your distance, meaning stay 6 feet from others and avoid crowded indoor spaces. Even if you don't personally feel like you are at risk, it is important to understand that this disease spreads person to person. It thrives on us being close together, and that a lot of people, in some cases up to 50%, can spread this disease without ever knowing that they have symptoms, meaning they are asymptomatic. And that is why if you don't wear a mask, then you could help promote disease spread, and you could be the reason why our schools aren't open. You could be the reason why our beauty salons aren't open. You could be the reason why our gyms aren't open, and you could be slowing us down. We can turn this thing around in just a matter of weeks. Arizona went from worst in the nation to one of the best in the nation. New York City's had a positivity rate under 1% for several weeks, and they were the worst in the world. And they've done it without a vaccine. So important to understand, we don't need to wait until we get a vaccine to drive down community transmission. If you all take the measures now to lower community spread, wear a mask, wash your hands, watch your distance, we can very quickly get into a better situation and safely reopen. Finally, I want to mention that we still do very much believe we will have a vaccine by the end of this year or early next year. Important to understand, we don't need to wait for that vaccine. But when that vaccine comes, it is important that people trust it and that they're willing to take it. This will also be our most important flu season of probably my lifetime. We cannot afford to have flu on top of COVID overwhelming our healthcare systems. You also need to understand that the symptoms for flu are the same as the symptoms for COVID. So if you have the flu and you come into work, they're going to have to shut down your job. If we try to reopen schools and someone comes in with the flu, they're going to have to shut down that class. So it is important to understand the best way to prevent flu is to get your flu shot. So I need all of you to get your flu shots this year and to encourage your family and friends to do the same, because it will not only prevent hospitalizations and death from the flu, but it will also help in our response to COVID and help us more quickly and safely reopen. And with that, I'll turn it over to my colleagues and then we'll take questions.
Our next speaker is going to be 2nd District Supervisor Zach Scrivner.
Thanks, Mary. Hi, everybody. Good afternoon. First of all, I want to extend our deepest gratitude to Dr. Adams for visiting us here. We had a quick turnaround time as far as getting notified of his visit. It would be on Friday morning, but we were able to put together, I think, a meaningful tour for him. He made some comments about that, and also we're able to gather a group of folks that represented, I think, a wide swath of our various industries in Kern County. We had ag, we had oil, we had aerospace, we had mining, we had education, we had healthcare, we had small business, we had folks that work in salons, we had gym owners. And so, we know how, and restaurateurs, so we know how much those various industries have been impacted, but they've been impacted to varying degrees, depending on where they are on the essential list. And so what we're striving for as a community, obviously, is to continue to suppress the spread of the virus so we can get more of our business sectors and our schools open. That is a goal for everyone, but we do know that it comes down to personal responsibility. There's a limit to how much government can do. We need everyone to concentrate on the 3 W's and taking this virus very seriously in your own homes, in your own backyards, because that's where the virus is being spread the most. It's in that contact with your friends and family. But as Dr. Adams said, we could really make an impact in a matter of weeks. 2 to 4 weeks, you saw other states, I think you mentioned Arizona, how they were one of the worst and they were able to turn it around. And so that's what's incumbent upon all of us to really take those guidelines to heart and do what we can as individuals. So the businesses that you love to patronize can reopen and reopen safely, and our kids can get back to school. I'm a father of 4. I have 4 kids, 8th grade, 6th grade, 3rd grade, 1st grade. They're learning at home right now. Would love to see my kids get back to school, but it's going to be incumbent upon all of us to find a way to make that happen. Thank you.
Our next presenter is 3rd District Supervisor Mike Maggard.
Hi, everyone. I just wanted to tell you what I think are a couple of highlights from today. The Surgeon General, Dr. Adams, has just been fantastic in helping us have the assurance that we have federal resources available for us here in Kern County. So we're going to present to him our strategy for how we can test and do that effectively, and he has given us his assurance he'll help us get the reagent and other supplies that we need to make sure that can happen. That's just manna from heaven falling on our lap, and I'm grateful to the Surgeon General for his willingness to do that. It also, I think, one of the other big takeaways today is he said to us, and also I'll say, he can speak for himself, but I'll say it as if he said it to me, we need your help to help us help ourselves. That's how we get our businesses back open. That's how we can save the jobs for all the families that need those jobs. That's how we get our schools open again. Well, our frontline first responders, doctors, and nurses are not getting sick, he said, by interacting with patients. They get sick when they're in the break room and they let their guard down. we are all vulnerable to letting our guard down. Having the family over for the weekend, the extended family, whatever that thing is, we need to make sure the public is adamant about following those 4 W's. Keep distance, wear the mask, wash your hands, do all the things that are necessary to do that. And that's how we're going to turn the corner on this. Lastly, I was very, very encouraged. Take all the spin, all the politics out of it. The entire resources of this fabulous nation are at work to find a cure for this disease. All the barriers have been taken out of the way so that can happen as quickly as possible. And that's just very, very encouraging. So I appreciate your message of hope and how important that is to the people that we represent, that they have a reason to hope. So thank you for your interest in this. I'm sure you want to ask him some more questions.
Our next speaker is CEO of Kern Medical, Russell Judd.
It has been a great joy today to be with Dr. Adams. He has come with a great amount of knowledge, a great amount of resources behind him, and an immense amount of charisma. He's a great leader, and it's been wonderful to be with him today. I echo what has been shared already, that as a community we need to be committed, that we can act, we control our destiny. If we'll practice those 3 W's, if we'll be careful, if we'll be wise, we can make a big influence and make a difference on this community. It's been great to be with Dr. Adams. He practiced medicine at a facility much like Kern Medical, as a trauma center and as a safety net institution. As we got a chance to tour our very busy trauma center, while we were in there today, we had 2 trauma activations, 2 traumas roll in to the emergency department while he was there. It was great to see his clinical commitment to the individual. He's concerned about our entire country. He's concerned about how he makes a difference in policy, but it's also very evident that he's controlled about the one person, as we all are. We can make a difference. We can conquer this disease as each one person does something about it. Again, it's been great to be part of a fantastic county. We've got great leadership. We're doing all that we can to make sure we conquer and quickly remove ourselves from this pandemic. Thank you.
Our next presenter is Bakersfield City Mayor Karen Go.
Thank you, Megan. What an honor it is to have Dr. Adams here today. He ended up this amazing day with saying, have hope. Have hope. And that is when we all come together, we really can make a difference. We are so close to having a big change here, aren't we, Dr. Adams? And so it is our personal responsibility. We want to see schools open. We want to see our restaurants open. We want to see houses of worship open. But it is up to us together to observe those 3 W's. So let's do it as a community. What a great day it's been to have that reinforcement that education is so important to reopen again, but it's up to us. It's up to parents, it's up to friends to work together to make a difference. So thank you all.
Our final presenter before we go to questions is President Jeff Huckabee from Grimway Farms.
Thank you. I just want to say thank you to Dr. Adams for coming today and spending the time to go around the room and talk to all the different industry leaders here in Kern County. So it means a lot to us to have your attention and the message that you brought about agriculture, about how important it is to the President, to the Vice President, to yourself. We appreciate you taking the time and understanding. We have a lot of employees out there working that have to go to work every single day to feed the nation. And it is very special to be able to explain some of the situations that we go through every day to keep this nation fed, and to know that the administration is listening and watching and caring. It means a lot to the agricultural community, and we just want to say thank you.
And I want my basket of blueberries and carrots to take home.
You got it. Thank you.
Okay, thank you. So here's how we're going to handle questions. I'm going to, much like we do our weekly press conferences, all of you are very familiar with this. We're going to go through the room, those of you in the room here first. I have an order that I'm going to go down. I'm going to ask you to ask one initial question. We are extremely pressed for time, and we are at the, we could potentially lose the Surgeon General, who may have to leave right away. So I have an order. I'm just going to go down the list. I'll ask you to ask your question. We'll pull up the appropriate individual. Once we've gone through those of you in the room, we'll turn to the line, the conference line, and I'll give you instructions when we get to that point. So our first outlet is the Bakersfield, Californian. Sam Morgan, did you have any questions?
Yes, my question was for Dr. Adams, and I'm just wondering, what would you say your primary goal was coming here to Bakersfield and taking a look around? What were you hoping to learn here or explain potentially?
So the question was, why did I come to Bakersfield today? And the reason I came here was, number one, to help everyone understand what's going right. And what's going right is that we have significantly lowered the death rate from this virus. We have now gotten to a place where as a nation our positivity rate is under 5%, which means as a nation we're in the green. But we still have some problem spots. And we know a lot of those problem areas are places where certain communities don't have the opportunities for health that we all enjoy. For instance, we know that black and brown communities are disproportionately impacted by this virus because of what we call social conditions or social determinants. For instance, one of the things we tell people to do is to telework if they can, but only 1 in 5 African Americans and 1 in 6 Hispanics has a job that allows them to telework. We tell people to isolate if they have the virus so they don't spread it to others. But unfortunately, black and brown people and indigenous persons often live in congregated housing settings that don't allow them to be able to isolate, which is why one of the places we visited here today with the mayor was a facility that houses people who need to isolate but can't do so at home. And I also wanted to give the folks here hope, because I know that there's a lot of fatigue. I know it feels like this has been going on for forever, but honestly, we are, I think, over the hump. I think we're over the hump because our positivity rates are coming down. I think we're over the hump because we're near a vaccine. Dr. Fauci still believes we're going to have a vaccine by the end of this year, beginning of next year. And I think we're over the hump because when you look at Arizona, when you look at New York, they've been able to quickly turn around their positivity rates and to reopen. And Arizona did it without having to completely shut down. So you don't have to shut down. It's not reopening versus health. We just need people to do their part, to have hope, but to realize that everyone needs to wash their hands, wear a mask, and watch their distance, meaning avoid crowded indoor spaces and stay 6 feet from others. And if you do that, we can reopen schools, we can reopen churches, we can reopen bars and restaurants, we can reopen gyms, and we can do it safely because we know that there won't be that high level of background community spread.
Okay, our next outlet is Channel 17. Aton, did you have questions?
Yes, Mr. Surgeon General, welcome to Kern County. You know, your overall impression, number one, what was your overall impression? And really, you talk about the fatigue there. Once people start going back to businesses and things reopen, what's the message? How do you get people to continue wearing the masks and do all that with all the fatigue?
So what my impression of Kern County was is that there is a tremendous amount of partnership going on here. And I think that is a great asset. I've been all across the country, and I haven't seen the diversity of people show up to a round table. Again, when you talk about the oil industry, the ag industry, the educational industry, the beautician industry, so many different folks along with public health and healthcare coming together to fight this virus. You mentioned what people need to remember. Well, they need to remember that government can only do so much, and that we ultimately have to take measures as individuals to protect ourselves and our communities as the government is working to protect us. And I want people to understand whenever they feel that it doesn't matter or that I'm not really at high risk, that your actions can have a direct positive impact on what happens right here in Bakersfield, right here in Kern County. And if you don't wear a mask and you are one of those people who asymptomatically spreads disease, then you're directly responsible for us not being able to reopen schools. If you make a decision not to have that large gathering right now until we can get the virus under control. And you're making a decision that will allow us to be able to reopen restaurants at limited capacity and to be able to do some of the things that we want to do. It really is on us to work together, and I want people to understand the connection between their actions and real, tangible results. We can turn this thing around in 2 to 4 weeks and really get back to a greater sense of normal if everyone does their part. Thank you.
Our next outlet is Channel 29. Jeff, did you have any questions?
Yes, Dr. Adams, you say that we're expecting to have this vaccine by the end of the year, if not early next year. Obviously, that's hopeful, and there is a chance that doesn't happen. You're putting a lot of responsibility on people to do their part. Life comes with inherent risks. At what point, if that vaccine doesn't come through, do we reopen even if the numbers aren't there? And we say proceed at your own risk, because that's essentially what you're telling people to do now.
So, great question. What I want people to understand, first of all, is reopening isn't just about the government saying you can reopen. If you reopen because the government says you can reopen, but nobody shows up to your restaurant, nobody goes to Disney World, nobody decides that they're going to go to visit their nail shop or salon, or parents don't feel confident sending their kids to school, then reopening really doesn't matter. We need to lower disease transmission so that people have the confidence to reopen and to re-engage in society. And that's, again, what the 3 W's come down to. And I want people to understand that a vaccine will help us stamp out this virus for good, but we don't need to wait for a vaccine to be able to reopen more places, because New York's positivity rate is under 1%, and it has been for weeks without a vaccine. Canada had 0 deaths 2 days ago. They did it without a vaccine. Many places across Europe and Asia have reopened schools and sporting events without a vaccine. The vaccine is really what helps us grind this disease into the ground, but it's not what's going to help us reopen. It's really what helps us reopen are the 3 W's: wearing a mask, washing your hands, and watching your distance. And a 4th W, we've got to have the will to do it. And it is not that big of an inconvenience. I have a 16, a 14, and a 10-year-old, and they're driving me and my wife crazy at home. And if wearing this means that my kids get to go to school, then that's not much of an inconvenience. If washing my hands means that I'm allowed to see the Raiders play, or to see the Rams play, or to see the Lakers or the Clippers play, that's not too big of an inconvenience. I want folks out there to understand we're not trying to take away your liberty. What we're trying to do is give you more freedom by giving you the tools to be able to safely reopen. And so if you want to reopen, then please do your part so that we can reopen with confidence.
Thank you, Doctor.
Okay, I'm just going to give you a quick warning. We literally have about 2 minutes before Dr. Adams needs to leave, so I'm going to go to Channel 23. Did you have any questions?
Yeah, for Dr. Adams, first of all, thank you for visiting Kern County and meeting with our county officials, all of whom have been working as hard as they can to, as safely and as fast as possible, get us closer to some sense of normalcy. Your visit comes at a time where our case rate has improved if you look at what it was in July. But with that said, as we were edging closer to move to the next tier of reopening our county officials have expressed some frustration with the state in, as they said, artificially adding percentage points to our case rate, putting us further away from being able to move to the next tier. So I guess my question is, did you have a chance to discuss with our county officials that element of this? And from what you've seen with other states, how has California been what do you think? How has California been working with? How do you think California's response has been so far?
Well, what's interesting is this virus has humbled us all. And California originally was one of the best in the nation. But what we found is that if you aren't vigilant, then this virus will come roaring back. What we've also found is this great nation of ours allows us to travel freely back and forth. And one of the interesting things about Bakersfield, about Kern County, is it's a crossroads for a lot of the state of California. And again, if we don't control the virus everywhere, and everyone doesn't do their part, then it will eventually come roaring back. And so what I would say to the people of Kern County is keep doing the right thing. Keep doing the right thing and encouraging your neighbors and partners to do the right thing. And if we do that, you will be able to reopen. There's always going to be some degree of conflict between the federal, the state, and local governments. And I heard some of that expressed today. But I do feel better about the ability for the state and for Kern County to get on the right page together and to really get this virus under control.
Okay, so that's all the time that we have for Dr. Adams. We want to thank you for being here. I appreciate it. We will stick around. I know they have to leave, but I will field questions on behalf of the supervisors if you guys have questions for them. We're also going to transfer to the line. Do you want to make any closing remarks?
I would just say that we have the local health officer here who can answer questions for you all, particularly related to viral spread in the community if you have any additional questions. But have hope. Don't give up. We're in the final leg of this race, I'm convinced. And what we need to get over the finish line is really a team effort. We need everyone to follow those 3 W's, wearing a mask, washing your hands, and watching your distance. We need all of you to get your flu shot this year, because if you don't, more places will be shut down. And we need you to understand that the vaccine development process for COVID is safe. It's effective. It's following previously determined FDA guidelines. There will be no shortcuts, and I will be in line to get a vaccine whenever it's available for me, and I encourage you to get your vaccine for COVID when it's available, in addition to your vaccine for flu as soon as you can, because that is the quickest and the easiest pathway to ensuring that we can open and stay open. And if you don't do it, then that is going to be the quickest and easiest pathway to ensure that we will be dealing with this virus for quite a while into the future. It really is up to you to work with us, and together we can overcome this virus in a short amount of time. So thank you again for the opportunity. I appreciate it.
Thank you.
Thank you. While the doctor departs, we're going to move to our outlets that are on the line. One second. Remember, it is *6 to unmute. Our first outlet on the phone should be KUZZ. I think we have Rob on the line.
I'm right here.
Rob, I'm sorry. It's a pleasure to see you.
Good, how you doing?
I'm doing well. Questions, recognizing that the doctor's left.
Yes, now that he's left, we'll change my question. Does County Public Health get any sort of heads up to Tuesday's update on where we stand in the color-coded system? I know that was frustration expressed last week. Has there been any change to
So
that?
the answer is no. We don't get an update. We learn about it when it's published.
So for the cameras, the answer was no. We find out when it's published, and that's according to our Public Health Director, Matt Constantine. Okay, our next outlet is El Popular. I believe we have George on the line. George, it's *6 to unmute. Okay, we're going to go to the next outlet, and if you're having trouble, gosh, hopefully that's not the case. Mountain Enterprise, I believe we have Marcy on the line. *6 to unmute. Okay, we'll try one more. I'm checking with our crew here. Kern Soul, I believe we have Celeste on the line. Any questions?
Hello, can you guys hear me?
We can now. Go ahead.
Okay, so this is a question for anyone that can answer. Do you guys expect a spike during flu season, and will flu season have any impact on COVID positivity rates?
Celeste, can you repeat that question one more time? We didn't have your volume up very high.
Okay, so my question is, do any of you expect a spike during flu season, and how will the flu season have any impact on COVID positivity rates?
Okay, we'll have our Director of Public Health respond.
Good afternoon. So we think that a lot of the preventative measures that we have been taking to address COVID-19 may have some positive impacts on our flu numbers in Kern County. At least we're optimistic it may. So as we practice those 3 W's that Dr. Adams just said, that will also have impacts for other diseases, especially the flu. So it's hard for us to predict each year. Every year seems to be a little bit different with the flu, but as Dr. Adams said, we're going to advocate strongly that when we have the flu vaccine available, and as it's coming out now, we're going to strongly encourage everybody to get their flu shot. Does that answer your question?
Yes, thank you.
Thank you.
Okay, our next outlet is it's Mojave Desert News. I believe we have Jack on the line. It's *6 to unmute.
No questions for me today, thanks.
Okay, thanks, Jack. Our next outlet is Valley Public Radio. I believe we have Carrie on the line. Any questions?
Hi there. Yes, thank you for taking all of our questions. Yeah, I wanted to talk a little bit about politics for a second. I mean, a lot of response to the virus has been political from many different people, from the public blaming some politicians, some political parties, some not. You know, there's been some bickering across the aisle, and I don't mean necessarily at the county level, but just kind of all around, blaming Newsom for some things, for not. You know, and so a number of you kind of spoke about this visit kind of maybe unifying or allowing people to talk across the aisle. Do you think that it helped unify the message, or it could help unify the message being sent to the public?
I think that is certainly the hope. When you have the U.S. Surgeon General show up at your door and tell you to have hope, and that there are some simple things that we can do, and that the power to reopen is in our hands as individuals, and if we take a little bit of personal responsibility and we make sure we do the 3 things that he asked us to do repeatedly, I think it's definitely a combining of forces. So yes, I believe it is a unifying moment.
Okay, thank you.
Our next outlet is the news. I believe it's the news review. Rebecca, *6 to unmute. Any questions? Nope, sorry. I'm going to go back to a couple at the top, just checking to make sure that we didn't have someone from El Popular on the line. George? And Mountain Enterprise, Marcy? *6 to unmute.
So, apparently Marcy's away. This is Patrick from the Mountain Enterprise. Can you hear me?
We can. Go ahead, Patrick.
Okay. We were concerned about the questions that were arising by the county addressed by the county administrator last week in regard to I guess impatience with the state setting certain standards for testing prevalence in order to be able to meet the goals. So I was wondering if in this visit today, have you defined some ways that we can accelerate and increase our testing protocols, our testing prevalence, I guess, and availability of testing? And of course, I'm always working on behalf of the mountain communities and the rural regions, that to know that, have you come up with some ideas to continue making tests more available?
So, Patrick, we're going to have Matt Constantine respond.
Thank you.
Hi, Patrick. So we're going to talk about We're going to talk about this more tomorrow at the board meeting, and there is an emergency item on with for Ryan Alsop to talk a little bit more about some creative ways to try to encourage greater testing. But you have summarized it correctly. The state has now artificially adjusted our case rate so that they are inflating our case rate because we are testing at lower than the state average. That presents some challenges for us as we are trending down and as our case rates are decreasing and our testing positivity rates are decreasing. We're getting closer to the next tier, to that red tier, which allows more businesses to open. So we are trying to get creative to encourage additional testing. As you know, we have 8 county sponsored sites, we have 3 state sponsored sites, we have 2 mobile sites. It looks like we're going to have a 3rd mobile site that will be here for about 3 days that the state is helping to sponsor, offering rapid testing. So there's a lot of testing. The capacity for testing is significant, and it is underutilized. Our concern, of course, is how do we incentivize more people to get tested, not only because, as Dr. Adams says, that helps us identify those that may be asymptomatic, and we actually want to then help isolate and quarantine and do our contact tracing, but it also affects our numbers and our ability then to meet that next tier and not have that case rate that's artificially adjusted. So we are going to explore some additional items as funding for these sites likely will go away in December. That also presents some challenges for us. So we are looking at how to sustain not only the testing that we have today, but the ongoing increased testing that we need to sustain to meet the state's new metrics. Did I answer all your questions, Patrick?
Just to please specifically about the rural mobile access, that's going to be a continuous cycle so that our people can continuously step up, because you saw we had a very good turnout in just a couple of days' notice. We had 300 people. So I'm hoping that you're going to continue that. Is that something we can report?
Yes, ma'am. So you're exactly right. The attendance at Pine Mountain Club and at Fraser Park, I believe, those numbers were terrific. We really appreciated your community responding. We hope to have some ability to do testing on a mobile basis for a period of time. It's always a challenge finding funding for it, but we want the community to respond just like it did in your area. And clearly there was a demand, and clearly there's an opportunity for us to go back and see if we can't increase those numbers again. So yes.
Thank you.
Okay, so that is all the time that we have questions for. I know there's a lot of outstanding questions related to some of the topics that we covered today. There is another report coming tomorrow during our board meeting. That's at 9 a.m. It is live streamed on YouTube, so if you're looking for that information, will be presented tomorrow morning. I want to thank Alex and Stephanie for being here today, and to all of our partners, and again, a big thank you to the U.S. Surgeon General for making his stop here in Kern County today. Thank you, and we'll see you tomorrow.